Hello everyone, how are you all? Hope you all are doing good. This is according to RGHS University. I'm going to take class for MSc first year students. Okay, so the subject is Pediatrics, and the unit 1, Historical Development of Pediatrics and Pediatric Nursing in India. So tell me, what is pediatric nursing? Yes, it is a medical care of neonates and children up to adolescence. So pediatric nursing is nothing but the care which is going to give from neonates to the adolescents. Usually inpatient hospital or day clinic. So this pediatric comes from the Greek words. Pedia means child, iatric means physician. Okay. So what is direct nursing care? Yes, the direct nursing care is nothing but the nurses is going to administer directly procedures and going to give the medicines to the children prescribed by the nursing care plans or else prescribed by the doctors. Okay, and nurses also continually assess the patient by observing. Yes, we all know the basic thing, right? Vital signs and the communication skills. It should be developed with the children and family members and with the medical teams. So this plays an important role, right? Because communication skill should have to the children, family members and with the medical team. Then only the goal can be achieved, right? And being a support to children and their families, it is one of the component of direct nursing care. So this awareness of the concerns of children and parents, being present physically at times of stress and implementing strategies to help children and family members cope, all part of the work. So this comes under the direct nursing care. Next is neonatal nursing. What is neonatal nursing? Neonatal nurses are registered nurse who specialize in working with these young vulnerable patients. So it is a branch of healthcare. It's going to mainly focus in providing care and support for newborn babies who were born prematurely, or else they may have some health problems such as birth defects, infections or heart deformities. Many neonatal nurses works in NICU. You know the full form? NICU? Yes, neonatal intensive care unit. So they are going to give, or else they are going to provide highly specialized medical care for the risk newborns. Okay, this is neonatal nursing. So neonatal nursing, it is nothing but the registered nurse will be dealing with the young vulnerable patients, and they are going to focus, or else they are going to provide care and support for the newborn babies who were born prematurely or are suffering from any health problems such as defects, birth defects, infections or heart deformities. And many nurses, neonatal nurses, work in NICU, neonatal intensive care unit, to provide highly specialized medical care for the risk newborns. I hope everyone understood it. So let's move to the next topic, that is pediatric emergency nursing. So what is pediatric emergency nursing? The emergency word itself says pediatric nurses are expected to have a fast mobility and quick response on stressful situations to contain the life-threatening situations. So pediatric emergency nursing is nothing but they should be always aware that, or else they should be always ready to help the patients such as life-threatening situations. So there are some key features of pediatric emergency nursing. What is that? Handling multifaceted trauma. We should be ready to handle such as trauma, injury, illness with the calmful way, right? Because in the urgency, or else whenever we are going to treat the patients, we should always be ready, and the patients should not feel that we are doing such a horrible thing and we are just running here and there, and by seeing us only, patients should not feel scared, right? So we should do everything in a calm way, but we should do it very fast. And stabilizing patients with focused and wholesome care, then we have to quickly diagnose the condition of the patient and should provide on-spot solutions. Suddenly we should provide the solutions. Then administering the right medications to minimize pain, keeping up with fast-paced work environment by constantly upgrading skills and knowledge, being patient and caring for the families who accompany the little patients, and working on easing their mental trauma. Most importantly, not giving into heartbreak and despair when some cases do not see improvement or success. We should learn to control our emotions, and moving on is the key to helping more and more patients in this work environment. So we should not, if we have the heartbreak situations also, we should not show ourselves to the others. If maybe the improvement or else success will be less, but still we have to learn to control our emotions. So what is the nursing goal can be said? Yes, normalize the life of the child during hospitalization in preparation for the family home, school and community. Minimize the impact of the child's unique condition. Foster maximal growth and development. Develop realistic, functional and coordinated home care plans for the children and families. Respect the role of the families in care of their children. So these are the nursing goals. So we should respect whatever the families, or else whatever the background the families are, we should respect their role, the children's role, the children's family's role. Alright, and we should develop the care plans, like functional coordinated home care plans for the children and families, and we should see the growth and development. So these are the nursing goals. Next comes to the career overview. So we know the about pediatric, right? Pediatric nurse practitioners. So this work in a wide range of settings, from doctors' offices and community-based settings to hospital and critical care facilities. The pediatric nurses may also assist pediatricians or work alongside them while providing care to the children. So they may assist pediatricians like the children's, or they may be with the providing care, like they are going to keep care to the children. So alongside, the nurses may join there also, and they provide care to children and adolescents in all aspects of their growth and well-being. Pediatric nurses give primary care such as diagnosing and treating most common childhood illness and developmental screenings. Acute care and specialty services are also available for the chronically ill children, some pediatric nurses and nurse practitioners focus on a specialty area such as cardiology, dermatology, gastroenterology, or oncology. So there are some pediatric nurses or else practitioners will be having the different department, let's say. Okay, so just for example, the each department it has is like for MSc means OBG, pediatric, community, oncology, like that, and all departments are there. They are going to specialize into it. Like that, in nursing department they are having each department for the pediatrics, right? So the nurse pediatric practitioners or else the nurse will be taking such specialty area they may take. Next is pediatric nurse practitioners, let's say PNP. Okay, so PNP is nothing but pediatric nurse practitioners. This play a large role in the lives of young people, in both sick and also healthy children. So pediatric nurse practitioners plays an important role for the sick children as well as the healthy children. To become a pediatric nurse practitioner, what we should study, what should be our qualification? Yes, you have to go to your school at least for 2 years. After taking the bachelor degree, you need to apply to your state board of nursing to be recognized as an advanced nurse practice or as advanced practice nurse. So this is nothing but after your plus 2 or else after your 12th grade, you need to do your bachelor course. It may be the GNM is for 3.5 years and BSc is for 4 years. That course you should do. Then you have to apply to your state, right? Then you get the registered certificate and you will be the member of nurse, or else you can work in the state, which state you are going to apply or else register, do the registration, there you can apply it. And there is also a separate examination that must be sat and passed in order for a pediatric nurse to practice as PNP. So there will be the SAT examination for this PNP, and some examinations are held for the jobs. For example, in the government sector, if we need to get means we need to write the examinations like that. And then next is patient education. So patient education helps to enhance treatment results. Nurses must be inclined to work with children at various levels of understanding, because in this field of nursing, patient is especially challenging. So patient education, it's nothing but we are studying regarding pediatric, right? So their education, it is going to help the treatment results. For example, if we see the children's, they won't be understanding anything, but if they have some education, if they know anything about the topic or else about their condition, they will they will also work with us, right? They will also work with us in the sense they are also going to understand the situation, and we can explain. So the nurses are going to explain to the children and they are going to understand the situation. But for the neonates, we can't teach anything, right? So here it comes to the nurses' role. Like, the nurses should know in which way we are going to convey the message to the children, especially for the adolescents also. So it's really challenging to adapt their language, to adapt their condition or else their environment, because each children is from different background, right? So it's really challenging, and children needs someone to help them adapt to the hospital setting and prepare them for medical treatments and procedures. And as a patient educator, pediatric nurses are also responsible for this care. Alright, So nurses also coach parents to observe and wait for important signs and responses to the therapies. So in such cases, everything the children won't be able to say it, right? So what the nurses are going to do is, the nurses are going to teach or else give information regarding the disease or else regarding what you should observe. Every information we are going to give to the patients' mothers or else their relatives who is staying next to the children. So the children's get comfort and even can provide the advanced care. So we should tell them to observe and wait for the signs and responses to the therapies. And another form of patient education is counseling. That's also plays an important role, right? Injury prevention strategies and anticipatory guidance is provided in counseling to boost development. So the patient education is counseling. In that counseling, there are two categories, that is injury prevention strategies and anticipatory guidance. This can boost their development. And helping the child or family solve a problem is often the focus in counseling, with responsibility of the advanced practice nurses or the other experienced nurses. So this ends with the patient education. Next is patient advocacy. What is the meaning of advocacy? Advocacy is nothing but public support for or recommendation of a particular cause or policy, right? So this expected effective advocate nurse must be aware of the following, that is child's and the family needs, the family's resources and the family's care services available in the hospital and community. Just for example, if the child is having a severe disease, that instruments whether it is there in the hospital or not, so these everything it should be ready, right? So it should be available in the hospital as well as in the community side. And the policies and resources of healthcare agencies must meet the psychosocial needs of children and families, where an advocate nurse must be sure of. And the nurses can be reinforce the family and the child to make knowledgeable choices about these services and to act in the child's best interest. So the nurses can then reinforce. What is the meaning of reinforce? To support or else to strengthen. So they can give support to the family. How the nurse can support to their family and the child? Yes, so we should give knowledge, or else we should give, to get their knowledge we should give some choices. Either you can do this or else either you can do that. So they can take the best choice by their own. If you are saying just for example, if the child is having chronic disease but this can be removed by the surgery or else can be cured, have to wait for several months and have to take the medicines, so we are going to give the choices according to their financial status. They are going to choose, so this can be reliable, right? So this completes patient advocacy. So these are some topics which you can remember. Okay, this is just for your knowledge and can be written like the introduction part. So we have discussed regarding direct nursing care, neonatal nursing, pediatric emergency nursing and their key features, nursing goals, career overview, pediatric nurse practitioners, patient education and patient advocacy. So these questions never asked before, but you can just study the introduction, or else in whatever the questions asked you can just write by your own, just like the introduction part. Okay, so while upcoming classes, if the important topics are there, means I will be telling these, you should remember, or else it is very important, I can tell you. But these are the introduction part. I hope you all understood. If any doubt is there, please let me know. Thank you for hearing my class. Thank you. Have a nice day.